Menopause already messed with your sleep, your mood, and your body. Now your ears are starting to ring too? What the heck is going on? One woman said it was like I had a teapot permanently whistling in my head, and no one believed me when I said it started during menopause. Most women expect hot flashes, night sweats, and brain fog, but not tinnitus. That high pitched sound that only you can hear, it's real, and it can be linked to your hormones, but it is manageable. I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus in Utah. I've helped hundreds of women understand and managed this unexpected symptom. And today, we're breaking the silence around menopause and tinnitus, why it happens, how your body and brain are involved, and what real treatments exist. If you've mentioned ringing in your ears and been brushed off by your physician, you're not really imagining that. Up to 30% of women report new or worsening tinnitus during perimenopause or menopause. For decades, menopause was just framed around hot flashes and mood swings, leaving millions of women in the dark about symptoms like tinnitus. That ringing isn't random, it's your body reacting to powerful hormonal shifts. I can't tell you how many women have sat in my office saying the same thing. Everyone told me it was just stress. But when you're constantly hearing sounds in quiet moments that aren't there, it's more than stress. It's your body asking for attention. When you understand that connection, the fear starts to fade because once we know why something is happening, we can finally start to change it. Think of estrogen as your body's audio technician. It fine tunes your hearing system. When estrogen levels begin to fluctuate or drop, it's like the soundboard goes haywire. Your auditory system loses balance and background noise creeps in, the filters fail, and the brain starts interpreting harmless signals as sound. Estrogen also supports the blood flow and nerve cells in your inner ear. When that support dips, tinnitus often appears. There's also a brain chemistry side to this. As estrogen drops, your brain's neurotransmitters, especially serotonin and dopamine, shift too. Those same chemicals that influence your mood also regulate how your brain filters sensory input. That's why tinnitus can feel louder when you're anxious, tired, or hormonal. It's not that the sound changes, it's that your brain's volume perception system is more reactive. This is part of why tinnitus and anxiety often show up hand in hand during menopause. Before we jump into treatments, it's worth understanding how the ear and brain feed off each other. Once tinnitus starts, your brain starts to build a feedback loop. It pays more attention to the sound because it tags it as dangerous or a threat. The more attention it gets, the louder it seems. That's why treatment often targets both symptoms, the physical hearing pathway and the brain's perception of sound. When we calm that loop, the volume of tinnitus naturally fades. Now for the empowering part, what you can do about it. Once you understand that tinnitus is not random, the next step is to work with your body, not against it. We always start by identifying which system needs the support: hormonal, neurological, emotional, and treat in layers. We work with your physician to maybe recommend hormone replacement therapy that can stabilize estrogen fluctuations that can trigger tinnitus in many women. But it's not a one size fits all solution. Some do well with bioidentical hormones, other with low dose transdermal estrogen. The goal isn't just symptom relief, it's to restore balance so the auditory system can calm down again. Always work with a menopause informed provider who can tailor your dosage, monitor changes, and adjust that safely. When hormone balance alone doesn't solve it, we shift our focus to how the brain is interpreting sound. That's where sound therapy comes in. Using gentle background sounds or wearable generators to retrain your brain to stop tagging tinnitus as a threat. Over time, your brain learns to tune it out the same way it ignores the refrigerator hum or distant traffic. Tinnitus and anxiety are often tangled together. Cognitive behavioral therapy helps break that cycle. It doesn't erase the tinnitus, it just changes your relationship with it. Patients often will say, I can still hear the tinnitus, but it stopped running my life. That's success. And technology is moving fast. Bimodal neuromodulation, using gentle electrical stimulation on the tongue, paired with sounds, helps recalibrate the brain's auditory networks. The Linear device, now FDA approved, is one of the first clinically validated tools showing measurable improvement in both tinnitus intensity and distress levels. And yes, medications can sometimes play a role, but they don't cure the tinnitus. They just help manage anxiety or sleep while other treatments take hold. The key here isn't to throw everything at it at once. Think of it as layers of retraining. Stabilize the hormones, calm the nervous system, reshape the brain's attention patterns. Progress often happens gradually, and that's a good thing. The slower your brain relearns, the more permanent the relief tends to be. Let's make sure that no one faces this alone. Click the like button to help other women discover this topic and subscribe to the video for upcoming things that keeps the conversation real. You have more influence than you think. An anti inflammatory diet, limiting caffeine, salt, and managing stress all can also help reduce tinnitus intensity. High cortisol levels also amplify brain sensitivity to tinnitus signals, so practices like mindfulness and deep breathing aren't just nice, they're true neurological tools. And don't underestimate your sleep. Both menopause and tinnitus disrupt rest, but a structured nighttime routine can lower reactivity and make the tinnitus less intrusive. Small environmental tweaks help too. Try adding a gentle background sound at night, like ocean waves or pink noise. It doesn't erase that tinnitus, but it gives your brain something else to lock onto. Some women also find relief through gentle movement like yoga, tai chi, or even a short walk before bed to discharge the body's tension and quiet that nervous system. Remember, the ringing isn't random, it's part of your body's hormonal journey. You're not broken, and you don't just have to live with it. So here's the roadmap in plain language. First, rule out medical causes for the tinnitus. Then, stabilize hormones if appropriate. Then add sound therapy or CBT to retrain your brain. And then add lifestyle tuning things like stress, diet, and sleep. And then you've covered every system involved. That's how we move from coping to control. From hormone replacement therapy and new therapies to daily habit changes, you have a full toolkit of options. And you can shift from being a passenger in this tinnitus journey to taking control. The most powerful thing I see in my patients isn't just reduced tinnitus, it's relief from the fear that it's permanent or untreatable. Once that fear fades, they start living life fully again. And that's the real goal. Less focus on the ringing, more focus on your life. You don't have to keep guessing on what's going on in your ears. You can visit our Learning Center to explore your options. And if you're in Utah, you can schedule an appointment in our clinic and start turning the volume down for good. I'll leave links below. Now, I want to hear from you. Have you noticed tinnitus more during menopause? What's helped you the most? Drop your story in the comments. Your experience can help other women feel more understood. Thanks for watching.